So you've clicked on the Classroom Action Healthy Eating button. Did you know that less than 25% of youth aged 2 to 7 eat the Canada Food Guide's recommended servings of fruit and vegetables each day? Action Schools BC Healthy Eating is going to focus on these. Vegetables and fruit play a significant role in preventing a number of chronic diseases. We've got to help replace unhealthy choices with healthier foods that contain the nutrients kids need to grow, learn, and play.
We're seeing sick kids get sicker and sicker. And the reason this is happening, by and large, is because of our food system and the way the government commodifies food, the way the government oversees our food, the way the USDA puts food on kids' plates that's unhealthy and allows unhealthy food into schools. And by tacitly, all of us send our kids or grandchildren or nieces or nephews to school and tell them to learn. Learn what's in those schools. And when you feed these kids bad food, that's what they're learning. So that's really what this is all about. The way we got here is because of big agribusiness. We now live in a country where most of us don't decide, by and large, what we eat. And then we talk about organic food. Now, most school districts can't really afford organic food, but we as a nation have to start thinking about consuming, growing, and feeding our children food that's not chock full of chemicals. We can't keep feeding our kids pesticides and herbicides and antibiotics and hormones. We can't keep doing that. It doesn't work. And the results of that are kids getting sick. Now, just in a few generations, we've gone from being 100%, 95% farmers to less than 2% of farmers. We now live in a country that has more prisoners than farmers. 2.1 million prisoners, 1.9 million farmers, and we spend $35,000 on average a year keeping a prisoner in prison, and school districts spend $500 a year feeding a child. It's no wonder. CDC, the Center for Disease Control, that has said, of the children born in the year 2000, those 7- and 8-year-olds today, 1 out of every 3 Caucasians, 1 out of every 2 African Americans and Hispanics are going to have diabetes in their lifetime. And if that's not enough, they've gone on to say most before they graduate high school. This means that 40 or 45% of all school-aged children could be insulin dependent within a decade. Within a decade. What's going to happen? Well, the CDC has gone further to say that those children born in the year 2000 could be the first generation in our country's history to die at a younger age than their parents, and it's because of what we feed them.
Lunch provides for 1/3 of your daily calorie intake. It is vital for children and teenagers to intake the necessary nutrients and vitamins to maintain a balanced diet and live a healthy lifestyle. The majority of lunch options served at schools are full of trans fats. With the obesity rates on the rise, the basic school lunches are not providing a solution for putting a halt to serious health problems across America.
Unhealthy options are so easily accessible throughout the school, with vending machines, entrepreneurship, and the chips, cookies, ice cream, and fried foods in the cafeteria. Healthy school lunches are not available every day to provide the nutrition many students need to do well academically and in their extracurricular activities. We propose that school lunches be made up of healthier options while still being affordable to all students and complying with the free and reduced lunch program.
While many people believe that having healthy options would create a loss in revenue, a recent study suggested that schools that have healthier options actually made more money, or the same amount of money, as schools that had unhealthy options. One of the overarching conclusions from the report is that students will buy and consume healthful foods and beverages, and in effect, the school can make more money from the more expensive healthful options that will sustain students' energy throughout the day.
About 24% of free lunches cost less than $2, far below the reimbursement rate, suggesting that free lunch programs in some districts may in effect cross-subsidize other business lines for the school food service. On the other hand, about 17% of free lunches cost more than $2.60, suggesting that the free lunch program effectively is subsidized by other sales. Some school food services earn higher profits at the margin by promoting a la carte sales at the expense of reimbursable meals, while others earn more by strongly backing the federal lunch program.
Simply adding a side salad or a side of fruit or vegetables is not enough to solve the problem. We propose that schools across the nation provide at least one healthy entree meal option each day. Not only does serving healthy options help students feel better and learn more efficiently, but also increases revenue for the school by putting healthy meal options at higher demand. In addition, medical expenses will lower as cases of diabetes and obesity become more scarce.